Obamacare subsidies expired earlier this year. What negative consequences have you seen, and do you see any policy adjustments that need to be made?
Let's talk about Obamacare. Take a step back. 2015, 16, 17, 18, 2020. There were 9 million people on Obamacare. 9 million. Today, it's more than 20 million. And what happened? What happened was we completely took the guardrails off. And I know this because I'm working in the agency that actually was told to take the guardrails off. And because there wasn't an earnest desire to keep track of whether you're appropriately on it or not, but more importantly, just get the number to where we all feel good about ourselves, we had massive increases of people joining the program. We believe that 35%, roughly, of the people that are using the Affordable Care Act, Obamacare exchanges, because they never used the program once, they've never filed a claim, may not be legit. And that actual number may translate to 5-6 million people we could be paying premiums for because they don't have to contribute anything. So they don't even know they're getting it. These are people who have Medicaid, and someone, often a broker, dishonestly enrolling them on in an Affordable Care Act, or they're in 2 states at once getting full insurance paid for by us in multiple states at once. So we have evaluated these numbers. They are extremely concerning. There's a very strong effort by us. We actually made a rule 2 weeks ago that starts the process. We had tried to do this when we first came into office. Court enjoined us. They did not feel we followed appropriate APA guidelines, government guidelines, and so we redid it and now went back out again. But if you care about the ACA, then you want us to take the fraud out. Let me just take a step back. If we want you to go back to work on Medicaid, what's going to happen? You're going to start making money. As you make money, you're going to make enough money to get above the poverty level. You're going to want to buy an Affordable Care Act product, or private industry. Commercial insurers are going to start using it. That's a good thing. We're getting America back up. They're getting into work, getting them into the stratosphere, building prosperity. So we want these programs to work together. But if you've got millions of people, literally, who are getting insurance that they don't want, they don't even know they have it, and we're all paying for it, that's tens of billions of dollars we're throwing away. That increases premiums for everybody. It drives affordability down. We're not going to tolerate it anymore. Sir in the back, in the air. Yes. No, only one question. It doesn't matter. One question.
Okay, so I'm going to ask you, the Turkish president, Recep Tayyip Erdogan, and American president has a good relation. And there's a report they're going to meet in Turkey and United States game in Los Angeles. Have you heard about it? And also there's a NATO summit in Turkey in July. So you're Turkish American, I don't know, do you have any idea? Are you going to join? And what you're thinking about Erdogan and Trump relations?
I have no idea about these meetings. I've not been invited to anything. I suspect I won't be invited to everything because I've got a lot of work to do here. Right there, go ahead. Yeah.
Jordan Conrad from Getaway Funded, back to the illegal aliens on Medicare and Medicaid. Last October, you announced that you had found over $1 billion in federal tax dollars going to illegal aliens. How much has that amount increased, as you say? And, it's kind of like fish in a barrel. Are these people being referred to immigration for prosecution and deportation?
The number has doubled from what I said last year. We're about $2 billion. The good news is that many states realize this is a problem, and they themselves have stopped doing this. Listen, it's the same basic story again and again. We as a nation make a decision because we're one people. Individual states have to take that decision and use it to the best of their ability. Some states don't do as good a job as other states. That's why we're looking to individual states for leadership, for better ideas to deal with many of these social problems that unfortunately begin to pile up over time, and they threaten the very foundation of our social net that supports all of us. That's why this matters so much. If you quiz the vice president, he grew up in an environment where he saw people abuse this. I know that's the case of people who are in the task force right now, the anti-fraud White House task force. So there's a passion about this, and for good reason. And the president calls the vice president Elliot Ness. He wants him, he likes the fact that he's taking this seriously, he's going at it, and he's doing what's best for the American people by making some tough decisions. One last question, take it away.
Not difficulty, but with the national security angle. The president has pushed very hard to renew FISA, Section 702. It expires in 10 days, just ahead of the World Cup. And there's this heightened threat environment with the war in the Middle East. We've heard all of these intel agencies talk about the threat environment these days and how people are very concerned about it. On Capitol Hill, you've had lawmakers today raising concern about Bill Pulte and on the Democrat side, questioning his ability to carry out that role fairly and not weaponize it. What can you say about to allay their concerns, and can you also answer a question that was posed by Susan Collins about whether Pulte has a security clearance himself?
And I don't know anything more about Bill Pulte than you do. I did not think that would be one of the questions that would come up here. I hadn't even heard the news when I walked out. Okay, let me leave you with, we have one last question, but I do want. Okay, go ahead, ask him, I'll come to you. I have a GOP question. What's your question?
Do you have any medical advice for the Americans out there that are suffering from a very serious ailment called Trump derangement syndrome?
I am concerned about folks who have focused their entire life energy on dislike of the president. It's disheartening to see people lost in that way, but you know, treating stupid is really hard, and it becomes a real problem. And these folks are off. The GLP-1s. Yeah. Let me just answer because I'm out of time. And
Very quick one. Are Americans giving real deal medication, brand name like Wegovy or Ozempic, or it will be generic on Trump Rx at $50 monthly?
The Trump RX product is the real deal, the true API, the pharmaceutical product that's made by the two major providers right now, which are Novo Nordisk and Eli Lilly. There are other companies coming into the space. We have these products that are given by these companies as part of this deal, so we'd like to use the real product to be able to satisfy the needs of the American consumer. It's a brand new. It's a brand new. Last question from the middle. No, last question. Take it away.
So Kenya basically has stopped, has asked US not to build the quarantine facility there. And the people, the responders from here who are supposed to go there, do you think the Trump administration's policy of not allowing people who are exposed, Americans who are exposed to the virus, come back to the US will dissuade these responders from going there?
No, I think we're going to work out with Secretary Rubio's leadership a very favorable arrangement with Kenya. I've been to Kenya. It's a beautiful country, very sophisticated people. They're going to do the right thing for everybody, and I think it's a perfect solution. I thank you very much for letting me participate. God bless you all. Take care.
All right, so there you have it.